So good morning to all. Myself and Dr. Ashok, Assistant Professor, Department of Family Medicine. So today we are going to discuss a very important topic. As you can see on the screen, the name of the topic is occupational health and diseases. So we'll be discussing in brief certain occupational health and diseases arising out of the occupation and how these can be prevented. So these are the contents for today's session. That is, first we'll see the classification of occupational diseases, how occupational diseases can be classified. Then we'll see briefly about pneumoconiosis, what is pneumoconiosis and what all occupational diseases are coming under pneumoconiosis, and what are the characteristic features of these diseases and the pneumoconiosis. Then we will discuss briefly about leg poisoning. Then we'll see about sickness absenteeism. Then we'll see about assessment of risk at work. And then finally, we'll come to the most important part, that is prevention of occupational diseases. How these occupational diseases can be prevented. So you can see in this picture that many of the people here are involved in different kinds of occupation. Some are involved in tractor industries, I guess, and some are in steel industries, some are in coal miners, some are like maybe in asbestos and sand blasting and rock blasting, all these industries. And you can see that all of these are very highly like unhygienic environment. Which can put anybody's health at risk. And many of them are children who are involved in these occupations. So coming to occupational diseases, so how do we define occupational diseases? So World Health Organization defines occupational disease as any disease which is contracted primarily as a result of an exposure to risk factors arising from work activity. So it is any occupational disease that a person gets when he, due to the occupation in which he or she is involved. Okay. So if he is working in a coal industry, he can get coal workers pneumoconiosis, which is called as anthracosis. If he is involved in the silica industry, then he can get something called as silicosis. If he is involved in, if he is an agricultural farmer, he can get something called as farmer's lung. Then there is, if somebody is involved in asbestos industry, then he can get something called as asbestosis. So these are the diseases which are arising out of or in the course of the employment. So the World Health Organization and International Labour Organization, they say that roughly 5 to 7% of global fatalities which are attributable to work-related illness, occupational injuries. And there is a list of occupational diseases officially recognized by the international and national legal systems. And these they play an important role in the prevention of and compensation for workers' diseases. So coming to the list of occupational diseases, so as per the International Labour Organization, there's a long list of occupational diseases, starting with occupational diseases caused by exposure to agents arising from work activities. So in that list we have your chemical agents, then we have your physical agents, then we have our biological agents. So chemical agents, such as you may be knowing, like those are working in industries which are involved in use of any chemical, which can be beryllium or cadmium or phosphorus or chromium and manganese and arsenic, mercury, lead, chlorine, carbon disulfide, halogen derivatives, benzene, etc. So these are all your chemical agents. Then we have something called as physical agents. Physical agents, those are involved in industries where there is a lot of noise, there is a lot of vibration, there is a presence of compressed or decompressed air, there is ionizing and optical radiations and extreme temperatures. Those are working in mines, they are exposed to extreme temperatures. Then we have biological agents like brucellosis, then hepatitis virus, and HIV virus, and tetanus, and tuberculosis, then anthrax, and leptospirosis, etc. Then we have occupational diseases by target organ systems. So in this we have your respiratory diseases like your pneumoconiosis, then tuberculosis, then cirrhosis, which is due to iron, which is excessive exposure to iron. Then we have asthma, then extensive allergic rhinitis, then COPD, and diseases caused by aluminum, then upper airway disorders, and those due to skin diseases, and those involving the skin diseases can lead to your contact dermatosis, then contact urticaria, then vitiligo, etc. Coming to occupational diseases by target organ systems, that is musculoskeletal disorders. We have your radial styloid tenosynovitis, monitoron bursitis, and prepatellar bursitis, then epicondylitis, meniscus lesions, carpal tunnel syndrome, and we have your mental and behavioral problems like your PES, post-traumatic stress disorder, PTSD. PTSD, that's post-traumatic stress disorder, which is the main issue right now with most of the occupations where everybody is under a lot of stress resulting in a traumatic stress disorder. Then we have occupational cancers, which can be mostly lung cancer, it can be gastrointestinal cancer, and it can be your opposite, bladder cancer and skin cancer is very important. And other diseases like your minus distracts. So classification of occupational diseases. So uh, these can be classified based on diseases which are due to your physical agents, like heat. We have excessive exposure to heat can result in heat hyperpyrexia, and heat exhaustion, then heat syncope, and heat cramps, and burns, and local effects such as critical heat. Same like heat, if there is excessive exposure to cold, it can result in something called as trench foot or frostbite, then chilblains, and those who are exposed to excessive light can develop occupational cataract, have your minus nystagmus, and we have your and again, if somebody is exposed to excessive pressure, like deep sea diving and all, then they can develop something called as your Casing's disease. Further, they can develop air embolism. Also, excessive pressure can result in explosion, that is blast. And same, if there is exposure to excessive noise, it can cause occupational deafness. And exposure to excessive radiation can result in cancer, leukemia, plastic anemia, and cytopenia. Then we have mechanical factors which can result in injuries and accidents. And we have electricity, exposure to electricity unknowingly can result to severe burns. So coming to diseases due to your chemical agents, gases, exposure to gases such as like carbon dioxide, carbon monoxide, hydrocyanic acid, carbon sulfide, nitrogen, hydrogen sulfide, hydrochloric acid, sulfur dioxide can lead to gas poisoning, which is very dangerous. So what is important here is a term called as pneumoconiosis. So pneumoconiosis involves all the occupational lung diseases which are resulting from inhaled dust in one or the other form during the operation. So coming to the dust, we have inorganic dust and we have organic dust. The inorganic dust, we have coal dust, which is called as coal dust. Coal dust, which is called as anthracosis. And there is we have silica dust, which is called as silicosis. Then asbestos, which is called as asbestosis. Further, we have the carbon one lung. Then we have iron, leading to something called as cyanosis. So these are all your inorganic dust, and we have your organic dust. That is organic dust. That is your cane sugar, cane fiber, that is sugarcane fiber, which is the end product of harvesting of sugarcane. So all this sugar has been removed. So that can result in something called as dioxosis. And then there is cotton dust, which is which is present when the cotton is taken and cotton is harvested, and it is called as vicinosis. And we have tobacco leading to tuberculosis, and we have last one is setting from agriculture, that is hay or grain dust, that is causing something called as farmers. So coming to diseases due to chemical agents again, we have metals and their compounds, some of the metals and their compounds. They can also cause occupational health issues such as if the person is exposed to metals such as lead, mercury, cadmium, manganese, and beryllium, and arsenic and chromium, etc. And also exposure to chemicals, exposure to chemicals such as your acids and alkalis and pesticides can also cause some occupational health issues. And also exposure to solvents in industries such as carbon bisulfide, benzene, dichloroethylene, chloroform, etc. So some of the diseases due to biological agents, we have those who are like veterinary doctors, veterinary surgeons, and those who are involved in research. If they are in contact with certain organisms, they can develop brucellosis, leptospirosis, anthrax, actinomycosis, iridosis, tuberculosis, tetanus, encephalitis, fungal infections, etc. Then we have occupational cancers. That is cancers resulting from occupation where certain chemicals or dyes are used, like industries where certain dyes are used, so the person can develop skin cancer, and certain chemicals or inhalation can lead to lung cancer and bladder cancer. Then we have occupational dermatosis, resulting in dermatitis, eczema, and diseases of the psychological origin, that is, we have industrial neurosis and hypertension, culture, etc. So coming to the very important part in this chapter, that is called as pneumoconiosis. So pneumoconiosis is essentially the word means pneumo meaning is relating to the lungs. Coniosis means dust. So dust in one or the other form, which is based on the occupation. When it leads to lung disease, it is called as pneumoconiosis. So it is a group of interstitial lung diseases. So here the lungs parenchyma reaction to certain, so it is the lung parenchyma's reaction to certain inhaled dust. So the dust size here is roughly between 0.5 to 3 micron. But again, the various effects of the dust depends on many things, depending on the chemical composition of the dust and the fineness, whether it is small size or bigger size, then the concentration of the dust in the air, if it is having a high concentration or low concentration or medium concentration, then period of exposure, whether the person is exposed daily 1 hour or 2 hours or like 6 hours or 8 hours, that is also again very important. The health status of the person exposed to health status of the person exposed, whether he's having any, he's a smoker. If he's a smoker, then it makes him more vulnerable to developing the particular health issue, health disease. And any pre-existing lung disease, any chronic lung disease, any asthma, anything can put the person at a greater risk of developing the occupational health problem. So in developed countries, the most common form of occupational health problem is asbestosis. And in developing countries, it is the most common is silicosis, followed by your asbestosis and your gallbladder disease. So coming to inhalation of dust, as I was mentioning earlier, so it is nothing but finely divided solid particles with size ranging from 0.1 to 150 microns, and they are released into the atmosphere during the crushing, grinding, braiding, loading, and unloading operations. So these dust they are mostly found in the mines and foundry and quarry, then concrete, then textile, then wood, stone working industries, and we have dust particles that are about 10 microns usually settle down from the air, usually settle down from the air rapidly, while the smaller ones they remain suspended indefinitely in the air, and that is what we breathe, and it goes deep inside the lungs and settles down in the alveoli. So there is a term called as respirable dust. So it is nothing but less than 5 microns. The dust particles are directly inhaled into the lungs and retained there. And dust, we have different sorts of dust. So we have inorganic dust, organic dust, like soluble and insoluble dust. So inorganic dust, we have generated during silica mining, then mica, then coal, then asbestos. Dust, then organic is your what you obtain from the cotton, from the sugar cane, then hay of the jute industry. Then the soluble and insoluble dust. So the soluble dust enters the systemic circulation, and insoluble dust remains permanently insoluble dust remains permanently lodged in the lungs because it is insoluble. So coming to another important disease that is called silicosis. So it is called a grinder's disease. So it is a progressive lung disease caused by inhalation of silicon for a long period of time, and it is a major cause of permanent disability and mortality. And it was first reported in India from the polar gold mines in Mysore in 1947. So this condition is very prevalent in the low and middle countries like India. And in India, the burden is like 3 million workers are at risk of exposure to silica, and prevalence of silicosis in India ranges widely, that is from 3.5% in northern countries to 54.6% in say the pencil industry. And large mining industries concentrated in states like Jharkhand, Chhattisgarh, West Bengal, and Odisha, and other industries which are involved in this, which generate silicon are southern industries generating silicon are those involved in mining and stone cutting, then construction work, then masonry, sandblasting, glass manufacturing, ceramics work, and steel work, and drawing. All this generates silicon. So the sources that is exposure to crystalline silica dust and can increase silica, and this originates from the crushing, breaking, grinding, sandblasting of our forest. And pathophysiology, there are four variants that is the silicosis. So in the beginning stage, it is a simple model of silicosis, followed by progressive massive fibrosis. Then we have something called a silicoproteinosis, then there is diffuse interstitial fibrosis. So the incubation period is here between few months to 6 years, and silicotics who develop silicosis are more prone to develop permanent tuberculosis, and they're called the silicotuberculosis. The compensation for silicosis, so under NHRC, India financial assistance to on-certified silicosis patients and the next of kin of disease of silicosis, the state government. So example like Rajasthan and Gujarat, they offer 1 lakh to support those certified silicosis patient, and 3 lakh to family of those who are died due to silicosis. And in West Bengal, they are offering roughly 2 lakhs to certified silicosis patient plus 4,000 monthly pension, and 4 lakh to family of those who are died due to silicosis. And silicosis is a notifiable disease under the Practice Act of 1948 and Mines Act of 1952. So coming to asbestosis, the asbestosis is a natural asbestos is the naturally occurring hydrogen sheet of fibers used in construction and insulation purposes. So asbestos fiber are divided into two groups. That is, there's an amphibold variety, which we have propylite and amosite and thermolite and all this. And there is a serpentine, that is a trisulfite. And epidemiology, global burden, roughly 125 million people are exposed to asbestos at workplace, and they roughly 1 lakh die each year. While India, the burden exposed to asbestos is roughly 1 lakh. So sources of asbestos is through asbestos mining and processing unit to cement industries and demolish old asbestos structures, then fire proof textiles. In India, we have there are Andhra Pradesh and Jharkhand, Rajasthan, which are mainly producing asbestos. So here in the picture, you can see there's a pile of asbestos placed in the Rodo Hills of Jharkhand. This is lying here since the last 35 years, which has been done here. And this makes all the people who are living surrounding this area prone to develop asbestosis. The pathophysiology for asbestosis. So asbestos initially enters the body by inhalation and ingestion, and the fine dust, because of its very fine dust, it is deposited in the alveoli, and it is insoluble fibers. And the lungs, further it can lead to pulmonary fibrosis, that's very bronchial, diffuse, basal incorporation. So clinical features, we have directly caused four distinct malignancies, that is the mesothelioma, then that is cancer of the flora and peritoneum, then your lung cancer, then ovarian cancer, and laryngeal cancer. And the disease It has developed, it is progressive even after removal of exposure. And asbestos-related diseases typically develop after 10 to 20 years of work exposure. So it is a very long-term exposure that leads to asbestosis and cancer development. So coming to anthracosis, that is a coal miners or a black lung. So this is nothing but repeated exposure to air pollution, inhalation of smoke, of coal dust, particles lead to accumulation of carbon in lungs. And the global prevalence is roughly about 3.4 to 21%. And there are two cases. That is, one is the simple pneumoconiosis, which is the earliest stage, and in this there is little respiratory impairment. And ideally, this develops after 5 years of exposure. And following this, the second stage that is called as progressive massive fibrosis. So here there is a severe respiratory disability and premature death can also occur. So the risk of death among coal miners has been nearly twice that of general population. And again, coal miners means pneumoconiosis have been declared a notifiable disease in the Indian mines Act of 1952, and is also compensable in the Workmen's Compensation Act of 1959. Coming to something called bicyanosis. So bicyanosis is due to inhalation of carbon fiber dust for a long period of time. So it ideally affects workers who are in the cotton processing industry or the hemp or the flax industries, and also known as Monday fever and the brown lung disease, and meal fever, cotton workers along. The early diagnosis is made and exposure to cotton dust is stopped. Most will not develop permanent lung damage. Symptoms can be reversed. So coming to bladder sources, so this is nothing but due to it is due to sugarcane fiber waste. And there is a form of hypersensitivity pneumonitis caused due to inhalation of the sugarcane fiber waste. And the conjunctive organism here is called as thermoactinomyces saccharide, and it is a thermophilic actinomycete. And the symptoms are as with all the pneumococci, there can be breathlessness, cough, cases, slight fever. Initially, there is acute diffuse bronchiolitis and impairment of pulmonary function. And if treated early, there is resolution of the acute inflammatory condition of the lung. And if left untreated, there is increased fibrosis, emphysema, and bronchiectasis. So coming to something called as harmless lung disease, FID. So it is the most prevalent form of hypersensitivity pneumonitis. So it is caused with the injection of microorganisms and moldy hair and dust from the brain or strong. And when these brain or strong are stored in damp conditions and the high levels of humidity, which is more than 30%, it leads to an increase in temperature of around 50 degrees temperature. And under these temperature, this the positive organism that is a thermophilic active acid as micropolyspora they develop and lead to farmers. And this is again characterized by your bronchial gases and cough formation. So there are three kinds of hypersensitivity reactions. One is your acute, then is your subacute, and your chronic. Acute that is develops within 4 to 8 hours of exposure to antigen and is characterized by dry cough, and fever, and chills, by dyspnea and tachycardia. And subacute takes a longer time, then is characterized by the muscle ache, then joint pain, and cough, then mild fever with chills, and loss of appetite, and dyspnea, then weight loss. And chronic condition is characterized with permanent lung damage and persistent cough, depression, body ache, joint pains, fever, and weight loss. So clinical features on pneumoconiosis. So this is important, and pneumoconiosis is characterized with persistence of cough. There is persistence of cough which worsens over time. There is shortness of breath. There is wheezing. Then there is hoarseness of voice. Then there can be in the sputum. There can be low grade fever. Then there is pain or tightening in the chest, and there can be weight loss. There can be loss of appetite, and there can be fatigue. Then there can be clubbing and cyanosis and distress. So diagnosis for any occupational disease, the diagnosis, the initial part is thorough and comprehensive occupational history of exposure. Then you have to make the person undergo lung function test, which is very important. as a majority of the cases the lungs are involved, so that we increase the mostly you have to go for vital capacity and total lung capacity. Then we can do sputum examination in case of asbestosis. You will find the asbestos bodies and chest X-ray and CT scan of the lungs and bronchoscopy, the lung biopsy, and tuberculosis should be thoroughly assessed. Should always keep in mind to look for tuberculosis. Tuberculosis should never be missed. So these are just X-ray findings in pneumoconiosis. You can see in silicosis, fibrosis, massive fibrosis. There is massive fibrosis and nodule formation in the upper lobes and multiple necrosis, spread hilar with nodes that is called as axial calcification, and there's a ground glass appearance. There's a ground glass appearance in the silicosis. In asbestosis, there is a diffuse periodontal fibrosis and its basal location, basal end location, and there is pleural plates present, and there is a smooth strong appearance. Management of pneumoconiosis. So most of the occupational lung diseases they progress even after cessation of exposure. So there is no effective pharmacological treatment, but they are 100% preventable diseases and withdrawal from further exposure. The smoking cessation is advised. So specific control of bradossosis is to keep the moisture content above 20% and spraying with 2% propionic acid which is on the side. Coming to the prevention of occupational diseases, we have there are three domains under prevention. The first one is the medical domain, and then we are engineering measures, then we are legislative measures. First we see the medical measures. So under medical measures, we have what is called as pre-placement examination. So pre-placement examination is the foundation of efficient occupational health service. So it is done at the time of employment and includes the workers' medical, family, occupational, and social history. And there should be a thorough physical examination and a set of biological and radiological examinations. And example, you have to make the person undergo chest X-ray, then ECG, then vision testing, then urine and blood examination, and special test for endemic diseases. And the purpose of doing a pre-placement examination is to place the right man in the right job. So periodic examination, there is many diseases of occupational origin require months or years for development. So slow development leads to non-recognition in the early stages. So frequency and content of periodical examination depends upon the type of occupation and occupational exposure. So ordinarily the workers are examined once a year, and occupational exposures to example toxic dyes or radium. Monthly examinations are indicated, and daily and daily examinations needed in case irritant chemicals like trichomates are handled. So next is your medical and healthcare services. So in India we have the employees state insurance scheme provides medical care not only for the worker but also his family. So within the country, first aid services should be made available, and properly applied first aid can reduce suffering and disability in Western recovery. And we have immunization should also be kept in mind for the health workers. So notification of occupational diseases is very important. So there are three acts. That is one is the Pancreas Act, under which there are 25 diseases that are included. We have Mines Act, under which three diseases are included. We have dogs regulations, which 8 diseases are listed. So these are recognized internationally for the purpose of workmen's compensation. Purpose of notification industry is to initiate measure for prevention and protection and ensuring their effective application. So industry investigate the working conditions and other circumstances which are caused or suspected to have caused occupational diseases. and supervision of the working environment. So for this, ideal division should be frequent visit to the factory to check the various aspects of the working environment like temperature, then lighting, then ventilation, then humidity, then noise, then cubic space, then air pollution, sanitation. And the doctor should be acquainted with raw materials, processes, and products that are manufactured. And also study in various aspects of occupational physiology, there is endurance of fatigue, and shift work and weight carried by the workers, and render advice to the factory management and all matters connected with the health and welfare of the workers, and should enlist the cooperation of the safety engineers and industrial hygienists and psychologists. So this is what is supervision of working environment. Then there should be maintenance and analysis of records. That is, proper records are essential for the planning, development, and efficient operation of an occupational health service. Workers' health record and occupational disability record must be maintained. Then there should be health education counseling that should be provided to the worker in the beginning. Should be given. Ideally, it should start before the worker enters the factory. All the risks involved in the industry and the measures to be taken and the personal protection should be explained to him. Correct use of protective devices like mask and gloves should also be explained. Simple rules of hygiene like hand washing, paring the nails, bodily cleanliness, and cleanliness of the clothes should be explained, and frequently reminded about the dangerous industry through charts, posters, and manuals. Coming to engineering measures, so here the engineering, the first thing is the design of the building. So designing of the industry begins from the blueprint stage. So when the industry is being set up, factory is being set up, they should think about the type of the floor based on the occupation of the people involved, the type of the floor that should be used, the walls, the height of the walls, the ceiling, the roof, the doors, and those cubic space. And these should also should be planned in the initial stages and should receive attention in the original plan of the building, which is put up by industrial architect. The next is good housekeeping, that is general cleanliness, ventilation, lighting, machine food arrangements, and general maintenance. Fundamental requirement for control or elimination of fishing hazards, contributes to efficiency in oil industry. So all ceilings and facilities should be wiped out at least once a year. And dust would settle down on the floor, ledges, beams, machinery, and other stationary objects must be removed by vacuum cleaners or by wetting agents. Mask, gloves, aprons, and other protective equipment should be kept clean and safe after repair. To prevent accidents, lighting should be in the right place. Inside and outside of the ground should be kept neat and clean and tidy. Then we have general ventilation. So every room of factory ventilating opening shall be provided in the proportion of 5 square feet for each worker employed in such room. Opening shall be such as to admit a continuous supply of fresh air and efficient exhaust ventilation system in rooms where dust is generated. Indian countries have prescribed a minimum of 500 cubic feet of air space for each worker. Then the use of mechanization. So plants should be mechanized to the fullest possible extent to reduce the hazard of contact with harmful substances. And dermatitis should be prevented if hand mixing is replaced. Dermatitis can be prevented if hand mixing is replaced with mechanical devices. Acids can be conveyed from one place to another through pipes. Then we have something called a substitution, where there is the replacement of a harmful material by a harmless one or a less toxic one. Example is substitution of white phosphorus by phosphorus sesqui sulfide in the match industry, which resulted in the elimination of necrosis of jaw, which is called a faucet jaw, or use of zinc or iron paints instead of harmful lead paints, silver salts in place of mercury salts, acetone in place of benzene. Substitution is not always possible in industry. Then there is next is process. There is control at the point of origin by process place. Example, let the other way of inclusion will keep moisture in the materials and make the processes of grinding, saving, and mixing comparatively dust free. So next comes to enclosure, that is enclosing the harmful materials in processes, prevent the escape of dust and the fumes. For example, grinding machinery can be completely enclosed. Then we have something called as isolation, that is isolate the offensive processes in a separate building so that workers not directly connected with the customer sales and exposure. Can be done at the night, can be done at night in the absence of the usual staff. So then comes the local exhaust ventilation that was best used in other injury sections of staff, static exhaust, and use of protective devices like respirators and gas masks and ear gloves and earmuffs and your helmets and safety shoes and aprons and gloves and boots and barrier and frames and screens and goggles. Then the environmental, I think that was periodical environmental surveys, periodical environmental surveys, then thermal environment, then regulation, then lighting that by doctors and engineers. Then we statistical monitoring, there is a review and regular intervals of collected data on light and environmental exposure to operational groups. Purpose is to evaluate the efficacy of preventive measures and occupational health criteria including possible exposure levels. And research is always to be continued in occupational health, which provides a proper ground for study, provide a better understanding of the industrial health problems. Some aspects that is study of the permissible limits of exposure to dust and toxic fumes, occupational cancer, accident prevention, industrial fatigue. So last is your legislation that is factor is more important than the machine which he operates. So factor cannot be permitted to endanger his life and then when an occupation by the employer makes a fortune. So country was saying in every country to govern the condition industries, safeguard the health and welfare of workers. So in India we have two acts. One is called Factories Act of 1948 and it's the Employers State Insurance Act of 1938. So these will be discussed in the section in the next session. So thank you for listening.